Hi, I'm Chris Preston with Idaho 2Fly. Tonight we're continuing our series on helpful hints and information when you have different types of cancer. Steve Drabeck will make an introduction about what tonight's program is all about, but we are out at St. Al's Physical Therapy. Idaho 2Fly is a nonprofit organization that was started a little over 10 years ago. We've helped more than 500 men with cancer. We have retreats, we have fishing days, we have all sorts of activities for men. And the real function is to help men deal with the emotional aspects of the disease, help with the feelings of isolation, realizing that they're not alone, that they're part of a much larger community than they realize. And when men realize this, it's much easier for their families. What we find is that most of us at Idaho 2Fly, we're passionate about it because we have a real personal connection to cancer. I have cancer, my wife is a cancer survivor, Steve, everybody here you're going to see tonight, we're all dealing with the disease, so we have a feeling for what's going on. About 35% of our patients or our guests have prostate cancer, so just because you don't have prostate cancer doesn't mean we can't help you. So if you have cancer, you have a friend with cancer, please have them go to our website. We have help that's available. You'll really enjoy it. It's proved very effective for lots of other people. So Steve?
My name is Steve Drabeck. I'm the Guest Services Coordinator with Idaho 2Fly. And we're here at St. Alphonse Physical Therapy Office. We're going to have Kenna Brinkman, who's one of the physical therapists here, put a presentation on about what to do after you've had surgery for prostate cancer. And a lot of us that have had prostate cancer have issues with leakage and a number of different issues. And she's got some physical therapy exercises and different things that we can utilize that will help us overcome some of those aspects. But Kenna has been working with a number of our guys, and one of the guests that's going to be here is Jim Walls, and he's going to come in and be with Kenna and show you some of the things that will help us in the challenges we have after surgery. So, Kenna?
Hello, my name is Kenna Brinkman. I'm a physical therapist with STARS Rehabilitation Services, and that's with St. Alphonse's Rehabilitation. So, and I'm a pelvic floor specialist, pelvic floor therapy specialist, and I'm here with Steve and with Jim Walls. And so we wanted to go over what we offer at STARS Physical Therapy. We have pelvic floor physical therapy in 4 different locations in the Treasure Valley. We have therapy at Boise, close to the St. Alphonsus Hospital on Liberty Street, and then we have in Meridian here at the Overland and Eagle location at Talus, and at Nampa Garrity, and also out in Fruitland. So we want to be able to serve you wherever you are located in the Treasure Valley. So we wanted to talk a little bit about what is pelvic floor therapy and why do I need it. And these 2 gentlemen with me can really speak to why it's really a good thing. And so I think it would be great to have them just talk a little bit about why therapy is important to start out with, even before you have a procedure.
All right. My name is Jim. I'm a stage 4 prostate cancer survivor. I went through the physical therapy with Kenna. A lot of concerns before you start. Have to deal with your fear of what's going to happen, what are they going to do, and also that there's a lot of embarrassment involved. You really got to kind of prepare yourself for it, but if you're going through what I went through, you kind of lose all that embarrassment and realize that it's something that has to be done. It really helped a lot. I wish I would have started before my operation, but it has, after working with Kenna, it has really helped me a lot with my pelvic floor.
And I'm Steve Drabeck. I had surgery here several years ago, and unfortunately I didn't do a lot of the exercises that Ken is going to talk about before the surgery. I wish I would have. I ended up having a number of issues as far as leakage and different things, and it seemed like every time I sneeze, it was like, oh my gosh, here we go again. And then I came out to see Kenna, and she went through a number of exercises that helped me in that area and really made a big difference. And the key to it, though, is not only doing him when you come in to see Kenna, but then doing him on a regular basis after the visit. But it was very helpful, and has helped solve a lot of problems down in that area. But I think any guy that has gone through surgery, especially, I'm not sure about radiation, and Kenna can probably tell you more about that, but I went through surgery and radiation. That aspect of that area of your body just seems to weaken up quite a bit, and those exercises really help a lot.
Yeah, the benefits of physical therapy, it's hard to imagine sometimes when you're going through this process of getting prepared for a procedure like this, because we're not as familiar with our pelvic floor as we are with other areas of our body. For instance, if you go and have a rotator cuff repair surgery for your shoulder, you anticipate that you're going to need physical therapy to recover from that. Or if you have a knee surgery, it's pretty standard. So yeah, as far as the concerns about coming to pelvic floor physical therapy, I understand that it can be a topic of embarrassment and discomfort because this is an area that is usually kept private. And but with our pelvic floor rehabilitation, we are aware that when you go through a procedure like a prostatectomy for cancer or radiation treatments, your bowel and bladder function and sexual function will be affected because the nerves and muscles are affected with the surgery. And so it varies for everybody, but we know that you can have a variety of symptoms, such as you're going to have leakage right after surgery, and you may have some pain. Some people have more pain than others, but it's usually not as painful as you might expect. But there can be spasms, there can be sensation changes, and so all of these things are unique and different with each case, but we just want to normalize those things for you and know that that's something that everyone who goes through this type of surgery will experience in one degree or another, and so we just want to make it as comfortable as possible to come here and get the help that you need. So as we talked about before, surgery is a really great time to come in, because before your surgery, then you'll be able to feel the muscles and understand what's happening a lot easier than it is right after surgery. So it's just nice to kind of come in and get a little bit of a heads up on what to expect. And then you can practice these exercises that we're going to talk about beforehand, and they would be just that much more prepared for the whole thing. So yeah, anything else that you wanted to add to that?
Well, I think the actual doing I think they're called the Kegels, doing those made such a huge difference in how much leakage I had. Wearing a pad all the time was kind of awkward and whatnot, and being able to get away from that made a big difference. And I think having those exercises beforehand would have made a huge difference, as opposed to having them just after. I think it's like any strengthening muscles. If you can strengthen those before you have surgery, recovery's a lot easier. And I wish I would have done that.
Okay.
And you're going to have leakage.
Yes.
It's going to happen.
Yes.
And along with the embarrassment, you think it's embarrassing to come in here, it's more embarrassing having to go buy pads at the grocery store.
Mm-hmm.
So there's a stigma to it. It's
Yeah, it's so true, and it's really good to talk about that and know that you're not alone. And that's the wonderful thing about this resource with Idaho 2 Fly and the support group, and meeting other men who have gone through this procedure to help comfort you and help guide you.
Absolutely.
Yeah. Getting that support and help you need is so important. Yes, and speaking to, we can talk a little bit about things that you can also do before surgery, just while we're on that topic, is getting yourself as healthy as possible. I know sometimes you don't have a lot of time because sometimes people are diagnosed really quickly, and so your surgery is scheduled really quickly. So, but just basic things like good nutrition, good sleep, you know, as much as you can when you're stressed to trying to figure out what to do with this new diagnosis, but getting, you know, as just healthy and fit as you can, whatever time you have to do that. And we'll talk about that more with after surgery too. But one other thing I wanted to mention with the leakage, while we're on the topic, is a lot of people ask, you know, well, how long am I going to be leaking? And it varies for everyone. Some people have some chronic leakage long term, but the good news is most people have a resolution of most of their leakage within about the first 6 months after surgery. Now, again, statistics vary a great deal, and we can never guarantee 100% control. But the learning about the muscles and learning what to do and how to contract them properly will make you make progress much faster than if you don't understand how to do it. And setbacks can be common sometimes if you have additional radiation treatments or other therapies on top of your surgery. It may delay your progress a little bit, but you can always make improvements. Even after several months or, you know, a year later, you can still make improvements with your strength. So we always want to encourage people to, if they've never tried physical therapy, no matter how long it's been after your procedure, to always come and give it a try.
Well, I think the other thing that's important is the continuation of it. That you don't come in and do a little bit and then say, okay, I'm cured, and you leave and think, okay, everything's going to be okay. It is something, I think, with this particular type of issue that you have down there, that you've got to do this all the time. That you've got to do your Kegels on a regular basis. I've found there's been several times that I've kind of just forgot to do the exercises. It's like any exercise program. Forgot to do the exercises, and next thing it's like, oh my gosh, I'm back to the same problem I had before. And it's just, you've got to keep that discipline up on doing it. You can do it sitting in a car, you can do it anywhere you want, but it's something you've got to do on a regular basis.
Yes, absolutely. It is kind of a use it or lose it type of thing. But the good news is once you learn how to do it correctly, like Steve says, you can throw it into any of your, you can be driving down the road and be doing your Kegels. You don't have to be setting aside a whole bunch of extra time to do them. And we love to combine this Kegel with other things you're already doing. If you're already going to the gym and doing exercises, you can combine this Kegel with those exercises too. So it's really an easy thing to work into your program once you already know how to do it. And it helps your bowel function, helps your urinary function, and it helps your sexual function. So it's just great to know that all the way around. So any other things you wanted to talk about in regards to what to expect or challenges? Okay, so next we're going to get into talking about kind of the anatomy of the musculature and what to expect to learn about the anatomy and the muscles, and then the basic exercises that we'll go over. So we're going to talk about the anatomy of the pelvic floor and the muscles that are there, and a little bit about what to expect after the surgery process. So well, if you look at our model here, we can see everything together as far as this is the bladder right here, and this is the prostate, and this is the urethra that goes from the bladder all the way through the prostate and down through the penis. So, and then we look at our pelvic floor muscles generally go from, this is the pubic bone, so the muscles start at the pubic bone and they go all the way back to around the anal sphincter, and then they attach back here to the back near the tailbone. So we have basically this sling effect with the pelvic floor muscles that go from the back to the front. And when you have your surgery, and we'll talk a little bit more about the muscles here too, but this is the prostate, that is removed. And so when we look up here at this diagram, this is the intact prostate here. And after it's removed, it looks like this, where they have taken the bladder neck and brought it down close to the muscle here. So the prostate is no longer there. And so the connection between the bladder neck and the muscle area where the urethra comes through is much closer together. You can see that after this space is, when the space is removed where the prostate is, then it changes the orientation of where the base of the bladder comes down. So if we look at this diagram, let's say that this is the prostate here, it is like a donut that goes around the urethra. So when the prostate is removed, there's a catheter that's placed during healing time here through the urethra, and so that when this bladder neck is brought closer, like I said, the urethral connections are made there. So this muscle is impacted because the nerves that go to the muscle area are impacted in different ways. If you have a nerve sparing procedure, then the nerves are much less affected than if you have nerves that have to be taken out based on where the cancer is. So depending on how much cancer is either encapsulated in or outside of the prostate. So anyway, the nerves are to the muscle are affected in different degrees. But regardless, because of the way the connection has to be changed here, then the muscle is just in a different, it's functioning a little differently at first, and so it's getting used to its new orientation. And so that's why when the catheter is in, you're not going to be doing exercises because you need to let that healing occur. The catheter is in for at least a week, but then when that catheter is taken out, then you can start contracting the muscle again. So basically, muscle here is your urethral sphincter muscle, which closes off the urine. So we can see that muscle here, we can see that muscle right here, and up here. And so that is the primary muscle that stops your urine flow. And that's the muscle we focus a lot on with physical therapy, but we also focus on deeper muscles. Like I mentioned, the muscles from the pubic bone back to the tailbone here. And so when we look at this picture, this is a person laying on their back, and this is the anal opening, and this is the base of the penis. And so we have this whole area of pelvic floor muscles as well, which helps us when we're trying to strengthen. So when you come to physical therapy, you learn how to contract muscles in the urethral sphincter area, which is, like we mentioned here, which you can't really see in this diagram because it's deeper. It's deeper inside. And so that's the muscle that if you were, when you're urinating, you stop and start your urine flow. That is the urethral sphincter muscle. It's kind of like a little circular donut muscle that's closing off that urethra. So that's what we want to practice. That's basically a Kegel. And then also these muscles here, we learn to strengthen by doing longer holds with all of the muscles involved, like you're stopping gas and stopping urine, and you're pulling all of those muscles up together, kind of like a little internal elevator to help give you more support. So that's going all the way from the pubic bone to the tailbone when we do that one. And that involves the anal sphincter too, so like you're stopping gas, like I mentioned. So that's basically what you're learning when you're coming to pelvic floor physical therapy, is how to properly contract those muscles. And the reason we need to learn that is sometimes we're doing things incorrectly. Sometimes we're squeezing our gluteal muscles instead of the pelvic floor, or sometimes we're kind of pushing down. We think we're squeezing properly, but we're actually pushing and straining. So everybody needs to learn how to do that properly so that they don't strain and have more problems with their pelvic floor. And especially that's very important after surgery, because as you're healing from this surgery, you want to learn how to heal and then properly contract so you're not going to compromise your surgery or cause any problems. And that's basically what we're learning with pelvic floor therapies. Okay, so now we're going to go over the basic Kegel exercises and a few other additional exercises that you may or may not learn from your therapist. Every therapist does things a little bit differently, so you'll just see variations in how the therapist teaches exercises for you. And of course, everything is going to be customized to what you need, because no two patients are exactly the same. So we just want to make sure that you get the best care individually that you need for your situation. So as we talked about in the anatomy section, we're just going to go over the basic Kegel exercises and how you would start doing them. So when you're learning how to find the muscles, it's just nice to start in a position where you're laying on your back so you can focus a little more specifically on those muscles. A lot of times we're tempted to squeeze our gluteal muscles back here, but we want to make sure that you're not substituting with those bigger muscles, because the pelvic floor tends to not work very well if you're just doing your glutes. So you want to learn how to find your pelvic floor. So first I'm just going to show Jim down kind of on the inside of the glute. That's the deeper pelvic floor, and I usually start with stopping gas first because we know how to do that typically. So Jim, if you can just kind of squeeze like you're stopping gas. Yeah. And can you feel that without your gluteal muscles?
Yes.
Awesome. Okay. So that's really important to do. And then we would, so with those stopping gas, you can practice gentle squeezes doing that. And so that's good to do before surgery, and then after your catheter's out, you'll be able to do that. Now, to focus on how to find the stop urine muscle, you have to go a little bit further between the base of the scrotum and the anal opening. So that's right in the middle of the pelvic floor. And so we'll just show kind of deeper in there. Can you feel that spot, Jim?
Yes.
Okay. So you want to focus right there and learn how to squeeze just those muscles like you're stopping urine, and trying to do pretty intense squeezes on and off. So you want to try that. Good. Okay. How does that feel, Tim?
It's different.
Yeah, it's different. So what makes this a little bit challenging to learn, do you think?
Definitely zeroing in on where the muscles are at.
Yeah, yeah.
Something that men don't usually do.
Yeah, men don't usually do. Women do quite a bit more than men, but but men usually don't get to figure out where this is. So it's okay to be patient with yourself and take a little time to learn this. Now, sometimes we might find ourselves holding our breath when we're trying because we're concentrating, so we want to make sure we're breathing with this. Sometimes I ask people to breathe out when they're doing the contraction. So try that, Jim. See if you can breathe out when you're doing the Kegel. How does that feel?
Yeah, you bring more in your ab muscles in that.
Yeah, yeah. So the abdominal muscles are an accessory muscle to the pelvic floor. And we want to make sure that you're not, number one, that you're not pushing the abdominals out or straining, but that you're just gently pulling them in and focused on the low abdominal muscles right above your pubic bone area. So that's a really great spot to focus on. And you want to practice being able to do pelvic floor with and without your abdominal muscles. So that's another challenging thing to figure out. But so you want to be able to breathe and pull in those muscles just like you're stopping urine, and then release it. Okay. And those should be fairly intense pulses, like you're stopping urine and stopping gas. And doing those individually, stopping urine, stopping gas, and getting in touch with the front area of your pelvic floor and the back area of your pelvic floor, because they really are two separate sphincter muscles. So, yeah, how does that feel, Tim?
It's work.
It's a lot more work than you think. It's trying to focus and really isolate those muscles, that's the challenge of this. And that's why it's really good to come before surgery if you can, because after surgery, it is a little bit tougher initially to feel these muscles because they've been affected, the sensation has been affected by the surgery in the beginning. And so, but you know, if you don't get a chance to come, still come after surgery. All right, now the other thing that we want to work on is the whole pelvic floor like we talked about. And so we do those longer, slower muscle contractions and holding up to about 10 seconds. So what I'd like you to think about, Jim, is starting from the back because we know where the stop gas muscles are. So trying to start there and just gently pulling in the stopping gas muscles, and then you move those muscles up forward toward the pelvic floor in the front like you're stopping urine too. So you kind of go from the back to the front, nice and slow.